Hey, it's Roberto Miki again, and we've got another great hand question of the week. It's number 30 in our series of questions for medical students, residents, and fellows studying for the boards or in-training exams. Well, let's get right into it. It's a shoulder anatomy question. Which statement about the suprascapular notch anatomy is true in reference to the suprascapular nerve and artery? A. Nerve below the ligament, artery above ligament. B. Nerve above ligament, artery below ligament. C. Nerve and artery above ligament. D. Nerve and artery below ligament. E. Nerve through the ligament and artery below ligament. Well, let's pause the video now and you can think about the question and answer it. The suprascapular notch is an anatomic structure on the superior border of the scapula. The suprascapular nerve runs in the notch below the suprascapular ligament. The suprascapular nerve innervates the supraspinatus and infraspinatus muscles. These are muscles of the rotator cuff. The suprascapular artery travels above the suprascapular ligament, and a mass or cyst in the area of the suprascapular notch will denervate both the supraspinatus and infraspinatus muscles, as opposed to a mass or cyst at the spinoglenal notch, which will denervate the infraspinatus muscle only. Well, let's go see some of that anatomy. This is the suprascapular notch seen from the front or anterior view of the scapula, and you can see it sort of highlighted in red there. And this is a video or GIF of the suprascapular notch in a circumferential and sort of rotational view of the scapula. You can see it from the posterior view here where you can't really see it, and then you can sort of see it better from the anterior view. But you can see that the nerve goes through that red notch, and there's a ligament sitting on the top of that red notch, and that is where the artery and nerve are separated. But the nerve passes through that little hole there and innervates the supraspinatus, which sits in that cavity there, and the infraspinatus, which sits on the lower cavity below the spine of the scapula. So that's the anatomy there of the suprascapular notch. Now, the spinoglenal notch is a little bit different, and it's shown there in red, and it basically separates the supraspinatus from the infraspinatus, and it's a gap where the suprascapular artery and suprascapular nerve travel to innervate and give blood supply to the infraspinatus muscle. If a cyst forms there or a mass forms there, it will only take out the suprascapular nerve that innervates the infraspinatus and will spare the supraspinatus. So that's a tip. That's a oftenly asked question on the boards as well, and so you should be familiar with that anatomical structure or area as well. Well, the answer to the question is A, nerve below ligament, artery above ligament. So the suprascapular nerve goes below the suprascapular ligament, and the suprascapular artery goes above the ligament. Well, I hope you learned something. I hope you enjoyed the video, and we'll see you in the next one. Remember to like and subscribe to help continue to support this channel.